Hello, my dear students and my dear friends. Assalamu alaikum and welcome back to Top Listen for You. Dear friends, I hope all of you are fine and enjoying your lives. My dear friends, in the previous lectures we discussed about the tibia bone, right? The features of upper part, the shaft and the lower part. We have covered about the tibia bone. Now, it's turn to cover about the fibula bone. So the fibula bone is a bone of the leg, right? Fibula is the bone of leg. Okay, the next thing about it is that it lies in the lateral side of your leg. Which part? In the lateral side of your leg. So for example, if this is the tibia bone, right? Tibia is lying medially and this will be your fibula. So fibula will be present in the lateral part of your leg. So this will be your fibula, this kind, right? So this, my left hand shows the lateral side, right? So fibula is also a long bone, right? Same for all long bones, it has an upper part, it has a shaft and it has a lower part, or we just say it has a proximal epiphysis, it has a distal epiphysis and it has a diaphysis, right? Now this, we know that this is a bone of the leg, right, and it is present in the lateral part of the leg. Now how to determine, either I have four fibula bones in my hand, which one is the right fibula and which one is the left fibula. So how to determine that, right? So we have written here the side determination. We will just right now know it. So we are discussing about the fibula bone external features, just about the external features. In the coming lectures, my dear friends, I will start the muscular anatomy in a big detail, and inshallah I will cover all the muscles of the body. Inshallah we will see those lectures in detail as we are recording these bones in detail. So inshallah we will see there, right? Soon inshallah I'm trying my best to cover the muscles also. So we are discussing about the anatomy of the fibula, its external features. So first of all, what is its anatomical position? It is held vertically up and down, so it has an upper expanded part and a lower, a little bit narrow part, right? I will discuss all the features of it in detail. So how to hold it? Either it is the upper end or this one is the upper end. So it's so easy. One side of the fibula bone, right, it's a little bit broader, right? Please make difference between them. This side is a little bit broader, but if you see this side, it's a little bit narrower, right? It's a little bit flattened. So we say this broader end is the upper end and this narrow end is the lower end. That's so simple. The next thing, how to determine the side of the tibia? It means that either this is the right tibia or the left tibia, fibula bone. So look carefully, I'm telling you very simplified way how to determine either it is right fibula or left fibula. My dear friends, if you look at the shaft of this bone, right, if you look at the shaft of this fibula, you will find there is a very sharp border there, right? You will find there is a very, if you can see in the camera right now, look, this is a very sharp border. So this is the anterior border, right? So if this is the anterior border, it should be kept anteriorly. That's so simple. It should be kept anteriorly. Done. So first of all, how to determine the which tibia, which fibula is that, either the right leg fibula or the left leg fibula. So first thing you have to do is that look for the very sharp border of it, right? So this is the shaft border, keep it anteriorly, right? Then the next point, the second point that will help you to recognize the right or the left tibia, it's very easy. The first point was the very sharp border should be interiorly. The next point, come to the lower part, and in the lower part, look, you will see here is the malleolus, right? This is the lateral malleolus, and in the lateral malleolus you can see here this is the depressed part, right? this depressed part, this is called the fossa, the malleolar fossa. This malleolar fossa should be medially. This malleolar fossa should be medially, and this sharp border should be interiorly. These are the two important points from which you can recognize either this is a right fibula or the left fibula. Once again, my dear friends, what I have told you right now, how to determine the side of the fibula. First, in the shaft of this fibula, try to find the sharpest border. Right, this is the sharpest border. It should be interiorly. That's done. Anteriorly, then go to the lower part, to the lower end, and in the malleolus, right, in the lateral malleolus, medially check please, there is a depressed part, right, this depressed part. So this depressed part is the malleolar fossa, right, and this malleolar fossa should be kept medially. So the sharpest border should be interiorly and the malleolar fossa should be medially, and you will find either it is left or right. Now let's do a practice first. Look, this is the sharpest border, and for me this is right now this is located interiorly. So right, this is anteriorly. Now if you look down, here is right, here is the malleolus and this is the malleolar fossa. So right, the malleolar fossa is medial to me and the sharpest border is interior to me. So that's it, right? This is the right fibula. Now if you want to check either it is left, so look carefully. If you bring the malleolar fossa medially, okay, then look for the sharpest border. It has gone posteriorly, right? So this is not the left fibula, this is the right fibula. Okay, sir. Next, this is a typical long bone and it is discussed under three titles that we have written here: an upper end, a shaft, and a lower end it has. So first of all, I'll discuss about the external features of the upper end of this fibula bone. So let's go for it. First of all, this upper end is a little bit expanded part from all sides, my dear friends. This is expanded from all sides, but the lower end is expanded anterior posteriorly but flattened sidewise. Look carefully. This is anterior posteriorly. If I turn it, it is expanded anterior posteriorly, but from side to side it is flattened, right? So we say the upper end is expanded from all sides. Okay, then the upper end has some important external features, that is the head of the fibula. So you can see here I have shown you in the picture also. This part shows the head of the fibula, right friends? So here we have the head of the fibula. This is the head of it. So let me color it with the red color. So here we have the head of the fibula. That's so simple. This is the head. Done. This is the head, right? Okay, then the next important thing about it is that there is an articular facet in the upper end of the fibula. There is an articular facet. Look at here. This is, if you follow the pointer of my mouse, this is the articular facet which I will show you here. This one is the articular facet here, right? And this is the facet which articulates with the facet of the tibia bone, which is present in the lateral condyle of the tibia, right? Here we have the articular facet for the fibula bone. So this this fibula bone will make a joint here, right? This will make a joint here, and it will show articulation here with the tibia, with the articular facet of the fibula in the tibia bone. So this here we have in the upper part of this expanded part of the upper end of the fibula bone, we have the articular facet for the facet of the tibia bone, right friends? Okay, so here we have what? This is the head and this is the articular facet. The next important feature or the external feature that we have here is the styloid process, or we call it the apex. So here you can see here, this is the styloid process of this bone. So let me color it with this green color and I will show you here. This is the styloid process here, right? So this is the head, this is the articular facet, and this is the styloid process, the narrow part, the upper narrowest part, which is called the apex, also apex of the head. We call it the apex of the head. So this is the styloid process, as you can see it also here. This is the styloid process, right? Then there is the neck of this bone. So here you can see is a very short and a very simple neck of this bone. So this is, my dear friends, the neck of the bone. So we have the four important features in the upper end of the fibula bone. That is the head of the fibula, right? We have shown you there. There is the articular facet, right? There is the styloid process, and then there is the neck of the upper end of the fibula, right, friends? Okay, done. Then the next important thing about this bone is the shaft of the bone, right? There is the shaft of the bone. So my dear friends, if you talk about the shaft of the fibula bone, its external features, so I have written here that this bone, the shaft of the fibula, has three surfaces and three borders, right? So here we have, first of all, I had told you this sharpest border is the interior border. Then here is a lateral border, and then there is a medial border it has. So let's go for it and see the borders of the fibula bone. So about the borders of the fibula, there are three borders. There is the interior border, and here you have the interior border, and I have written there that the interior border begins at the anterior aspects of the head. So if you can see here, this is the head of the fibula, right? This is the head of the fibula. Now the interior border actually begins right at the anterior aspects of the head of the fibula, right? So this sharpest border is the anterior border. Then it makes a triangular area at the end. Now if you follow the anterior border here, right, look here, it makes a triangular part. So if I show you here, right here, this is the triangular part that this anterior border makes. Look here. Right, friends? Okay, so this is that triangular part that this exterior and the anterior border, when it goes down, it expands a little bit and makes a triangular area in the lower end of the shaft. So this is the triangular area, right? So about the anterior border, we said that this is the sharpest border of the of the fibula bone, right? Then there is a posterior border, and this posterior border is a little bit rounded. Look here, this is the interior border, and this finger shows the posterior border here. So this is the posterior border of it. So let me color it. This is, my dear friends, this is your anterior border, right? With the green color, I'm showing this is the interior border, and when it goes down, it makes a triangular part. So this is the interior border. Now posterior lateral to it, there is the posterior border, right? So if you see here, this will be your posterior border, right? So with the blue color, I've shown here the posterior border, and the posterior border is a little bit rounded. I told you the interior border is very, very sharp, but the posterior border is not that sharp. It is a little bit rounded, and upper end, it is continuous with the styloid process. If you see here, look, this is the posterior border, and when it goes up, it continues with the styloid process. So you see here, this is the styloid process, and then its lower end is continuous with the groove of the lateral malleolus. So look here, here we have the lateral malleolus, and this malleolus has a groove part here. So this lower border will come down here and will make a connection with the groove of the lateral malleolus. So that's the 2 points about the posterior border, and we will discuss about the attachments later, right, friends? Then there is the medial border of this fibula bone. So where is the medial border? Actually, let me color it with black color. This is your medial border, right, my dear friends? This is the medial border. So look carefully. This is the medial border. If you keep it in its anatomical position, this is the anterior border, right? This is the posterior border, and this will be the medial border, or this medial border is also known as interosseous border, right? And its lower end meets a triangular area near the talar facet. So when this medial border comes down, again here it makes a triangular area. So let me show it also here. This is that triangular area which the medial border will make in its lower part. Right, friends? So here we have the triangular area. So this is the medial border, and this is that triangular area, and this is the anterior border, and this red color shows its triangular area. So friends, near the talar facet, I will discuss about the talar facet. Okay, so how many borders it has? It has 3 borders, and what are those? The anterior border, you can see here, this is the sharpest border. Then there is the posterior border. It's a little bit rounded, right? You can see here, this is the posterior border. And then there is the medial border. So this will be towards the tibia bone. This is the medial border of it, right, friends? And it makes on the lower end, it makes again a very triangular area near the articular facet of the talar bone. Okay, these were the borders. Then it has 3 surfaces. And what are those surfaces? Look carefully. If you hold it in its anatomical position, this will be the medial surface, right? As here will be your tibia bone. Okay, this will be your tibia bone. Here we have it. Okay, don't worry. So leave that. This is the tibia bone, fibula bone. This is the medial border, medial surface. Then there is a posterior surface, and then there is a lateral surface. This lateral surface is a little bit spiral. It comes down, 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 and goes back. So we say the lateral surface is a little bit spiral in nature. So how many surfaces it has? It has these 3 surfaces. There is a medial surface, there is a lateral surface, and then there is a posterior surface. So how many surfaces? 3 surfaces. Okay. In the shaft of this bone, there is a very, very special part, and this is called the nutrient foramen, which it has, right? This is here is a foramen there where the fibular artery will enter and supply blood to the fibula bone. So here is a very fine hole there, a foramen there. This is called the nutrient foramen, which this bone has for the nutrient artery. So there are 3 surfaces: the lateral surface, the medial surface, and the posterior surface. So in this video we discussed about the upper end and the shaft of the fibula bone. In the next video we will discuss about its lower end and the external features of it. So till then guys, Allah Hafiz.